بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about presenting chest cases with both diagnosis. The first case, here we see coronal CT scan image, and we see a large lymph node with calcification, and the calcification is punctate calcification. It is consistent with the granulomatous disease. The list of differential diagnoses include TB, tuberculosis, or histoplasmosis. Histoplasmosis is endemic in some countries, and TB also endemic in some countries. In my country, TB is the top of the differential diagnosis. Here, the second case, we have chest X-ray shows diffuse granularity involving both lungs, and it is typical of a neonatal surfactant deficiency, also known as respiratory distress syndrome or hyaline membrane disease, and it is occur exclusively in premature infants and treated with exogenous surfactant. Here, a third case, patient with chest X-ray BA view. As we see here, the left scapula is elevated compared to the right side, and we see also left omovertebral bone. And this scapula is elevated. We call it springal scapula, and the omovertebral bone. Both together is a bout of syndrome called Klippel-Feil syndrome. Lungs appear clear. Here, a patient with chest X-ray AB view, cavitating lung lesion with air fluid level in the right upper zone. What could be? As in the CT scan, we see the air fluid level in the posterior segment of the right upper lobe, and it is surrounded by ground glass opacities due to pneumonic infiltration, and this is cavitating or necrotizing pneumonia or abscess. Here, this neonate presented with respiratory distress, as we see chest X-ray shows multiple lucences or bubbly lucences in the left hemothorax, and pushing the mediastinal structure of the trachea, esophagus, and the heart to the right side. And left hemidiaphragm is not well seen, and this is a classic example of congenital diaphragmatic hernia, and the prognosis depends on the lung development. Here we have lateral chest X-ray as we see the colon seen in the protruded anteriorly through the foramen morgagni to the chest, and this is called morgagni hernia. And it is more common on the right side than on the left side. Here is another neonate with respiratory distress. As we see here, the newborn multiple lucences involving the left hemithorax with deviation of the mediastinal structure, esophagus, endotracheal, trachea, and the heart to the right side. Also, the thymus is uh, pushed to the right side, and this is a classic example of congenital diaphragmatic hernia. And it is less likely to be congenital pulmonary airway malformation (CPAM). Here, this is a child with multiple cystic lesion, almost the same, involving both lungs, and this is a classic for LAM, lymphangiomyomatosis, and this is associated with tuberous sclerosis or can be isolated, and it is exclusively in female patient. Here another child, adolescent with chest X-ray or associated with multiple obesities involving the both lungs. Some of them cystic, some of them looks like acinar shadows due to mucoid impaction, and the cystic one it is due to bronchiectasis, and this is associated with hyperinflation, and this is a classic example of cystic fibrosis. Here, this patient chest X-ray with endotracheal tube, and we see there is absent of the clavicle, and this is a typical example of ecleidocranial dysplasia, and it is skeletal dysplasia associated with either absent or hypoplastic clavicle associated with widened pubic symphysis and abnormal appearance in the hand and associated with multiple Wehrmann's bone. Here, another example, infant patient with respiratory distress. As we see here, the anterior ribs near the costochondral junction appear bulbous in appearance and pronounced with some irregularity and fraying in the humeri of the humeri, and this is a classic example of rachitic rosary, and it is seen also in rickets. This child presented with respiratory distress, as we see here, lucency surrounding the mediastinum and separated from the cardiac silhouette, and it is uh, a classic example of a pneumomediastinum, and we see the thymus is lifted away from the heart, and this sign is, we call it a spinnaker sign, spinnaker cell sign, and it is different from thymic cell sign of the normal thymus. Here, this child with mass seen above the diaphragm and below diaphragm, and we call it thoraco-abdominal sign. And that sign, if we see the mass above and below the diaphragm, and this is should be posterior in location, and this is a posterior mediastinal mass, and it is in your neurogenic tumor, and this is in your neuroblastoma. Here, another example of 3D reformat chest CT scan, and we see this is the trachea and ab- the right upper lobe bronchus arising from the trachea, and we call it a tracheal bronchus. And this patient uh, has Down syndrome, and the tracheal bronchus seen commonly in pigs. Here, axial cut CT scan shows ground glass opacities involving the central portion of the lungs and sparing the peripheral portion, associated with thickening of the interstitium. And this is a classic example of uh, pulmonary alveolar proteinosis. And this is a rare disorder characterized by accumulation of the proteinaceous material in the alveoli. Here, this is a neonate with respiratory distress. As we see a bubbly mass in the left lung. With the CT scan, we see the mass containing multiple cysts of large cyst, and this is a classic example of cystic pulmonary airway malformation (CPAM). Sequestration and congenital diaphragmatic hernia are in differential diagnosis but less likely. And this type 1 CBAM, the type 2 is less than 2 centimeter and in size, the cyst, and type 3 is about less than 5 millimeter in size. Thank you for listening, hoping you like this presentation.